Hello friends, myself Darshan H. Girigowda, currently studying in class 11 in Learners PU College. Today I am here to tell you all about diabetes, the world's known and common disease. I'll talk about the topic on the basis of 5W1H, means what, who, why, where, when and how. First of all, what is diabetes? Diabetes mellitus, commonly known as diabetes, is a group of metabolic disorders characterized by a high blood sugar level over a prolonged period of time. Diabetes is due to either the pancreas not producing enough insulin or the cells of the body not responding properly to the insulin produced. If left untreated, diabetes can cause many complications. Complications is an unfavorable result of a disease, health condition, or treatment. Signs and symptoms of diabetes mellitus: weight loss, polyuria means increased urination, polydipsia means increased thirst, and polyphagia means increased hunger. In addition to the known ones above, they include blurred vision, headache, fatigue, slow healing of cuts or injury, and itchy skin. This is the diagram showing signs and symptoms of diabetes mellitus. Complications: all forms of diabetes increase the risk of long-term complications. These typically develop after many years, that may be 10 to 20. The major long-term complications relate to damage to blood vessels. Diabetes doubles the risk of cardiovascular disease. This is the diagram showing the complications of diabetes mellitus. Types of diabetes: there are three main types of diabetes mellitus: type 1 diabetes, type 2 diabetes, gestational diabetes. Type 1 diabetes results from the pancreas's failure to produce enough insulin due to loss of beta cells. Type 2 diabetes begins with insulin resistance, a condition in which cells fail to respond to insulin properly. Gestational diabetes is the third main form and occurs when pregnant women without a previous history of diabetes develop high blood sugar levels. Causes of diabetes mellitus: obesity or being overweight, impaired glucose tolerance, high blood pressure, gestational diabetes, sedentary lifestyle, genetic transmission, family history, or age. Sedentary lifestyle is a lifestyle involving little or no physical activity. Preventive measures: maintaining a normal body weight, engaging in physical activity, avoiding excessive quantity of sugar, eating fiber rich food, drinking water as your primary beverage, quit smoking, follow a very low carb diet. This is the 7 key steps to diabetes prevention. Medication: type 1 diabetes must be managed with insulin injection. Type 2 diabetes may be treated with medications such as insulin sensitizers with or without insulin. Types of insulin: rapid acting insulin, short acting insulin, intermediate acting insulin, long acting insulin. This table shows the difference between four main types of insulin. Epidemiology: epidemiology is the study and analysis of the distribution, patterns, and determinants of health and disease condition in defined population. The global diabetes prevalence in 2019 is estimated to be 9.3%, rising to 10.2% by 2030 and 10.9% by 2045. The prevalence is higher in urban than rural areas and in high income than low income countries. This graph shows the diabetes prevalence in age groups. We get confused between diabetes mellitus with diabetes insipidus, but diabetes mellitus is different from diabetes insipidus. Diabetes insipidus. Diabetes insipidus is a condition characterized by large amounts of dilute urine and increased thirst. The amount of urine produced can be nearly 20 liters per day. Complications may include dehydration or seizures. Seizures is a sudden uncontrolled electrical disturbance in the brain. Damage to pituitary gland or hypothalamus from a surgery, a tumor, a head injury, or an illness can cause central diabetes insipidus by affecting the usual production, storage, and release of ADH hormone. ADH is antidiuretic hormone released by hypothalamus, which is responsible for the amount of urine produced. History of diabetes. Diabetes was one of the first diseases described with an Egyptian manuscript from 1500 BC mentioning too great emptying of the urine. Indian physicians around the same time identified the disease and classified it as Madhumeha or honey urine, noting the urine would attract ants. The term mellitus or from honey was added by Briton John Raleigh in late 1700s. Effective treatment was not developed until the early part of 20th century, when Canadians Frederick Banting and Charles Herbert Best isolated and purified insulin in 1921 and 1922. This was followed by the development of long-acting insulin (NPH) in the 1940s. NPH is neutral protamine hegdor. World's Diabetes Day. It is celebrated on 14 November. November 14th is a significant date in the diabetes calendar because it marks the birthday of the man who co-discovered insulin, Frederick Banting. The blue circle is the universal symbol for diabetes. It signifies the unity of the global diabetes community in response to the rising number of people affected by diabetes. This is the mind map on the topic diabetes. Quotes of the day. Mind is like a parachute. It doesn't work if it isn't open. Prevention is better than cure. If you cannot do great things, do small things in a great way. Thank you for watching my video. Bye bye.